Welcome to our 5 on 5. Pleased to be joined today by Oregon Health and Science University President Dr. Danny Jacobs. Good to see you, sir. Thanks for coming down.
Thank you very much.
Appreciate it. So, I guess we'll start with what is OHSU's presence here in Southern Oregon?
Gosh, we have any number of areas where we have a presence in Southern Oregon. The context is that we believe that Oregon Health and Science University has a duty to attend to the health and well-being of Oregonians in any of our mission areas, in all of our mission areas, patient care, education, and research, where our campus is the state's 98,000 square miles. So if you look at our university and our efforts, we actually have a presence in every county in the state. But in this particular area, there are a couple things that I would highlight. One is it's really important as regards providing areas where our learners can become the providers we want them to be. So we have residents and other trainees that come to this area and serve in the local community at the local clinics. That's important, we think, for the community, but also for our future providers. We have partnerships around nursing in particular with Southern Oregon University, where that's a partnership. It allows folks interested in nursing careers to be able to do part of their training close to where they live and then partner with OHSU to get their Bachelor of Science degree in nursing. I think that's critically important. Our research programs look to ask and answer questions around healthcare delivery in all communities in Oregon. So having the opportunity to work with local providers in that area is critically important. And then finally, you know, we provide healthcare for those who have needs that can't be addressed locally. I was looking at some statistics recently, and it's something like in the past year, 10,000 patients from this area have come to HSU for their care, which is meant to say that there are things that we might be able to provide that can't be provided locally, but we do all of those things in partnership, and we ask those questions in partnership with the local providers.
Do you have any plans to ensure we keep in-state docs coming to the Rogue Valley, or coming to rural Oregon, if you will?
Well, I think one of the things we can do is, besides what I mentioned earlier, where our trainees come and work in the community, turns out that's one of the best predictors of who is more likely to stay in a community. So the more we're able to provide these kinds of opportunities, and you know, there's a really good example, many of our surgery residents actually do surgical rotations here, and that's a requirement. And if you look at the folks who are most likely to stay in the community and practice, it's because of opportunities like that. So anything we can do to extend or enhance these resident rotations, along with providing opportunities for learners early in their careers to practice in a community, the better it is that the more likely it is that they will help and stay locally.
Okay, interesting. We're going to take a quick commercial break.
Okay.
We'll have much more in a moment. Stay with us.
All right, very good.
Welcome back to our 5 on 5. Going to hear with OHSU President Dr. Danny Jacobs. So we're talking about your involvement statewide with OHSU. The medical experts here tell me that we need more primary care physicians. What do you think about that? Is that possible?
I think it's essential. I think it is possible, and we're doing what we can to try and enhance the likelihood of folks choosing primary care as their profession. So as you may know, family medicine is one of our leading programs at OHSU. In fact, by many measures, is ranked #1 in the country in terms of where you might want to go and train to learn about family medicine as it's going to be practiced in the near future. So I think the summary would be primary care services. I think in our future, we're going to find it even more important to have skilled, masterful primary care providers who know their craft, but also know the importance of working in teams. Because most of the statistics in this country suggest that even if we change things dramatically overnight and double the number of medical schools and double the number of folks that went into family medicine, we still wouldn't have enough providers to attend to the needs of the community. So that means we have to pursue interprofessional practice, which means the family physician, the primary care provider, is part of a team, a pharmacist, a dentist, a nurse, an occupational therapist, a physical therapist, all the folks coming together to bring their own individual expertise in a patient-centered and family-oriented fashion. So teams are critically important. oftentimes led by a primary care provider, but that's what we're trying to teach our folks to do. And then telemedicine, the ability to extend presence across
I was gonna ask you
distances
about that.
is
Yeah.
critically important. We already have a presence like that in Medford and in other parts of the state. Our thought is we need to figure out how to make that even better. Imagine a world that's going to be coming very soon where in addition to a conversation like this you might have over the wires, you actually have information from devices or other sensors that can inform the information you're sharing verbally. So I think digital technology, sensors and related sensor technology is something that an academic health center needs to embrace and lead the way in terms of its impact on this issue of healthcare delivery.
Interesting. All right. So I know you're meeting with some of the medical community
Yeah,
here while
we
you're
are.
here
Yeah,
today.
yeah.
So what? Maybe this dovetails into that. What role should OHSU play in supporting or partnering with Oregon hospitals outside Portland?
Partnership is one of the things, or partnerships, the opportunity to partner is what attracted me to this job in the first place. So if our charge is to attend to the health and well-being of all Oregonians across all 98,000 square miles, that means we have to ask, how can we partner? Because I think the danger would be that someone in Portland at a premier academic health center would somehow believe they have a better sense of what the community needs than those folks in the community. So that dialogue is critically important. You know, we have expertise and resources that extend the full array of academic medicine, but how to deploy those, when and if and how, is a local conversation. So we're very interested in saying, well, what can we do to help you with the issues you think are most important in your community? But, we can help train, we can help inform, we can partner around research, and we can partner around healthcare delivery.
All right. Well, I wish I had more time. I do have a lot more questions, but I appreciate you taking the time.
All right. Thank you very much. Yes,
Thanks
sir.
very
Thank
much.
you, Mr. All right. Thank you.
Stay with us. We'll be right back.